So I just wanted to say hello, everyone. Happy Monday, and thank you so much for joining us for Power to Decide's kickoff of Power Talk, a discussion-led series that will feature leaders in the sexual and reproductive health field. My name is Roxy Szal, and in addition to being a feminist, a big-time advocate for birth control and birth control access, and a huge fan of Power to Decide, my 9 to 5 is working as the associate digital editor for Ms. Magazine, and also as a co-producer on the podcast Ms. puts out, which is called On the Issues with Michelle Goodwin. I was so thrilled to be invited to moderate this panel because I fully support Power to Decide and these Power Talks, which give space for us to celebrate all that birth control does for people everywhere, as well as to discuss all that's left to do to make birth control less controversial. This talk, which will last between 30 and 45 minutes, is taking place just 2 days before Thanks Birth Control Day, which, mark your calendars, is this Wednesday, November 18th, Thanks Birth Control Day. There are tons of ways to get involved, especially on social media, by using the hashtag Thanks Birth Control. That's THX Birth Control. And right now, I'd like to introduce our 3 amazing panelists who will be guiding us in our conversation about birth control today. First up is Dr. Gillian Seely, who is the interim CEO at Power to Decide. Gillian has deep experience in leading policy and systems work in a variety of settings, including schools and communities, as well as expertise in the social determinants of health. Gillian has worked at the local, regional, and national levels and has built scaling and sustainability practices for all of these settings. Next, we have Dr. Megan Stubbs, a sexologist, relationships expert, and body image specialist. With degrees in biology and human sexuality, she is able to combine 2 of her favorite things, science and sex, into a cohesive platform to impact her audience. She is mindful of inclusion and brings a sensitivity to ethnic diversity rooted in her own complex heritage. Megan is also coming out with a new book this April, which is called Playing Without a Partner, a Singles Guide to Sex, Dating, and Happiness. And finally, we have Dr. Staci Tanouye, a board-certified gynecologist physician and a women's health blogger who is passionate about creating a comfortable, safe, and inclusive environment to empower women to learn and love their bodies. Thank you so much to Gillian, Megan, and Dr. Staci. Let's get going. So the first question I'd love to discuss is pretty open-ended. Can you all speak about some of the benefits of birth control, especially what you're seeing on the ground in your respective lanes? What does birth control do for people or allow people to do? And I'm going to start with Dr. Staci on this one.
Sure. Birth control is freedom. It really just allows people and really anyone with a uterus to live their lives like they want to, with the sexual freedom that they want to, with the, they get to live pain-free, they get to live free of periods or with less periods, and with all of the benefits that birth control has, really it just allows them to be who they want to be without any limitations.
Yeah, I firmly agree. And I think birth control helps people decide if, when, and under what circumstances to become pregnant and to have a child. And I think they're just, as was just stated, I think there's just a freeing, right, to be able to make the choice around your own reproductive and sexual health, right? So whether that's birth control allowing you to complete your education, to improve your financial situation, employment prospects for yourself, it really allows people the autonomy to make those decisions for themselves and their families.
I'd like to co-sign both of those amazing sentiments. It is freedom. It's choosing to say, my body, my rules. And also something we haven't touched on yet is it can be gender affirming. So if something like having a period is going to cause you distress, we have options to prevent that from happening. And that's really great because we are all about freedom and choosing what you want to have happen with your body.
Couldn't agree more. Could not agree more. The next thing I'd want to talk about then is messaging and perspective. So, in keeping with all these positive things that y'all just mentioned, why in 2020 is birth control still seen as controversial? And what do you wish people knew about birth control? And maybe Megan, would you like to chime in first?
For sure. I think all of the stigma always goes back to the fact that this is related to something sexual, and people have so many hangups when it comes to sexuality. And so even though we're saying birth control, sex isn't even in that word, but it's in people's minds. And the thing is like birth control might be a misnomer, because you can be on birth control and not be sexually active. It is not just the only reason to be on birth control. So it's really limiting if we just look at the scope of birth control in the form of like, oh, you just want to have lots of sex. Well, maybe, but other reasons for being on birth control are totally valid too.
Yeah, I mean, birth control, like you said, it's about sexuality, and it's particularly about female sexuality and trans male sexuality, which are things that have been pushed behind closed doors forever. And that's all under control that, that other people want. So to take back that control is just a wild concept that people just seem to sometimes not be ready for. And that's part of the reason why it's just so taboo is really just that concept of taking back the control of the sexuality and sexual health, and really just health in general. It's just a powerful thing that people aren't ready to give up from the other side.
And I think, as you mentioned, like, I think it's still mystifying that why in 2021, it still seems controversial. I can speak from personal experience, having grown up on an island that is quite conservative. Contraception was not readily talked about. And when it was talked about, it was talked about in hushed tones. So I think, it also has to do with, the way how your parents, your grandparents talked about sex, talked about contraceptives, and really the truth be told, when it comes to birth control, it really is not controversial, right? So for one, 86% of adults support access to all methods of birth control, regardless of, race, region, political affiliation. And when you look, almost 99% of women who have ever had sex with men have used contraception at some point in their lives. So I really, hope that we get to a point where that it's not seen as taboo, and this really is just a part of a person's health and the choices that they make for themselves.
Totally agree. Well, obviously, we're in the middle of a pandemic. So, switching gears a bit to talk a little bit about the pandemic, COVID-19 has affected people's sexual and reproductive health choices, as social distancing and the disruption caused by the pandemic have created physical and economic barriers to contraception and other sexual and reproductive health services. In fact, 1 in 3 women reported that because of the pandemic, they had to delay or cancel visiting a healthcare provider for sexual and reproductive health care, or had trouble getting their birth control. And as is often the case, barriers to timely care were more common among Black, Hispanic, queer, and low-income patients. What do you want people to know about birth control during the pandemic? Maybe Gillian, we could start with you.
Sure. So I think you kind of laid out, the effects that the pandemic has had, and I think, there are clearly some impacts that we have all felt ourselves, and getting access to our reproductive and sexual health as well as contraception is one of those things. When you just mentioned that people have really started to think about, the formation of their families because of the pandemic, especially as we're social distancing and sheltering in place. It has really impacted people being able to go to a doctor face to face to get their contraception. And as we know, there are time elements to this. And so, it really is important as we talk about contraception in the pandemic that we continue to provide access for people to be able to get their contraception. So what we have seen during this pandemic is, an increase in telehealth services, which has really filled a critical healthcare gap, including for birth control, right? And telehealth options have allowed people to get, for instance, birth control delivered to their door. So that is an option for people who, again, are not being able to see their physicians face to face. And in fact, many of these telehealth companies are providing low cost options, free shipping. Some of them accept insurance. So that could mean that there's no cost to you. And I think that, this is really important when we talk about the impacts of the pandemic from an economic standpoint, because we know that quite a few people have lost their jobs. They are now underinsured or uninsured. And so thinking about, what are some of the solutions that we can think about as people look to continue their contraception. I will say, and I always offer this caveat, that we are well aware that telehealth services, if you live in a rural area and you don't have stable internet, might be an issue, but we do still think that this is a viable option during the pandemic for folks to get their contraception.
Yeah, I think if any great thing from healthcare comes from the pandemic, it's going to be telehealth, and just the ability to expand our reach to our patients in that way, and to allow them better access to us. I've had visits with many patients where they're, either at home or they're even away because they went to, a family member's house to stay away from the pandemic, but to be around someone. So I've been able to see my patients in settings that they would have never have come to see me in. So if anything comes of this in healthcare, I'm really glad, and I hope telehealth stays. I also want people to know that as physicians and as providers, we are still here. Just because the pandemic is going on and some normal elective services may be shut down, doctors and other healthcare providers, we can't abandon our patients. I mean, it's actually against the law for us to abandon our patients. So if you are lucky enough to have a doctor, a primary care doctor, a gynecologist, a pediatrician, anyone that you're established with, their office is still open. They still have to answer their phones. They still have to return phone calls, and we are still sending out birth control. As a physician, I never, ever, ever want to leave my patients without whatever birth control they need and whatever method that is. So please call your doctor's office if you have one. Like Gillian said, all of the online telehealth birth control pharmacies are there. A lot of the big box pharmacies have transitioned to mail prescriptions. And so even if you went to one of the big box normal pharmacies, they're doing mail options. Many insurance companies have mail order options that you can just get them shipped to your house. And if you don't have insurance, in terms of simple things, there are things like $4 prescription drug lists at certain stores and pharmacies. So trying to make this more accessible. So I hate the idea that people are going without their birth control. So please, we are here and we don't want you to be without your birth control.
It's so heartening to hear Dr. Staci, as a provider, advocate so strongly for her patients' well-being and care. I think the pandemic has shown us a lot of things, but when it comes to birth control, we don't need to compromise. There isn't I'll just have to wait until I can get into the office physically. No, we have telehealth options. We have options to still be seen in an office setting, and we can get birth control at the drugstore mailed to us. There are options. So don't think you have to compromise on what has been going on for you, what's been working for you, because a pandemic's going on and you're like, I don't know. There are ways. So don't feel like you have to get off birth control and maybe compromise your future plans.
Yeah. Right. And I also want to point out that I know a lot of people, kind of an old school practice, physicians and healthcare providers used to require patients to come into the office for their preventative health visit to get their birth control prescription. And I really feel like that's a completely outdated practice, pandemic aside. Again, I never, ever, ever want patients to go out without their birth control. So if people just called me and said, hey, I am not going to be able to have an appointment or a preventative health appointment or anything for this amount of time, that's fine. We have on the phone, we will confirm that you are safe and healthy, and we will send out refills until we can get to a point where we can get a visit for you. Never, ever, ever do we want you to be without that. We won't hold your birth control hostage just because of the pandemic. So we want you to be safe.
Yeah, and Roxy, I was just going to say as well, it's in following up to all that my colleagues have just said, a recent poll for Power to Decide, 80% of birth control users 18 to 34 said that birth control allowed them to worry about one less thing during the pandemic, right? And so to the points that are being made, that we don't want people to go without their birth control, and there are, various options so that people are able to get that birth control. So whether that's calling your doctor or your insurance company to see if it's covered, or calling to get it delivered to your door, we want to make sure that people know the access points that they can get birth control by.
I hope everyone hears that. We have options. There are options. I love that what you said, Dr. Staci, that we're not holding your birth control hostage, because sometimes I think the doctors and insurance companies, it can kind of become a little bit confusing. And so to hear that from a provider to say, we do not want you to go without care, I think is very powerful.
Yeah.
Well, here's something else I've been wondering. Contraception affects all of us who want to provide unplanned motherhood as well as unplanned fatherhood. So why do you think then that contraception is often portrayed as quote unquote a women's issue? When in reality it's more of a partner decision. Staci, do you want to speak on that a little bit?
Yeah, I think it goes back to the conundrum of partially that people want it both ways, right? They want to control and legislate the uteruses in people, but they don't want to take responsibility for that. They want responsibility to lie on the individual. And so I think it then becomes, globally, we want to control this problem and we want to control what happens to your body. But when it comes down to it, individually, that's your responsibility. And so I think all that pressure always gets put onto the owner. And so again, people want it both ways, right? They want control, but they don't want the responsibility. And so that's why it always gets pushed onto, the uterus owners to take control of all of that.
I would agree with that. And I think because there are fewer options for penis owners to have birth control, where I'm thinking various methods, they can carry those around. There's no pill as of yet,
Right.
shot, implant, anything like that. So it often does fall to the uterus owners. But if you're going to be engaging in sexual acts with a penis owner, responsibility is going to be 50-50. It should be. So it should be a conversation you're having with your sexual partner. But unfortunately, it, like Dr. Staci said, it does fall onto the uterus owners.
Yeah, I agree. And I think, that happens also too, because people see the female anatomy carrying the fetus. And so they're like, oh, if there is an unplanned pregnancy, or if there's a pregnancy, that should fall to the woman. And to what was just said, I think it really is a shared conversation if that's what needs to happen between two people in terms of birth control. I will say though that I do put a point that as we advocate and we push for access to the full spectrum of contraceptive methods for all, that we definitely want those allies, right? Those fathers, those male partners, men, we want to hear those voices of men as well who are advocating to make sure that people have the access that they need, especially as we know access issues continue to remain for women of color, women living in poverty, women living in rural areas. So clearly we want those male voices to speak up for those access issues as well.
Right. And it also, it takes both parties to make this a more comfortable conversation, both from a control standpoint to an actual contraceptive standpoint to a responsibility standpoint. Like both parties have to be comfortable in that space and in that conversation to really make any headway of, responsibility of motherhood versus fatherhood or both. So yes, those conversations just need to happen on both sides.
And it impacts family formation, right?
Right.
And so, we definitely know that access to contraception is not and should not only be a woman's issue, as again, it impacts society, it impacts families in significant ways.
And maybe this might help if you have sort of some reluctant allies in your life, listeners, because I think a lot of y'all have sort of mentioned this, that birth control is not always related to sex, even though, of course, that reason is valid because sex is great. But, for example, I take birth control for health and sex reasons. So other than sexual intercourse, can y'all speak to some of the other uses for birth control?
Yeah, so up to 50% of people who are using birth control, a hormonal birth control of some sort, are using it not for birth control and contraception. They're using it for these other health benefits that we see with all the various hormonal methods. And so it's acne control, it's period control, it is pain control. And so there's many different other health benefits that we use these hormonal methods for. for people just to be able to literally live their lives, to go to work on a daily basis and not in pain, to go to school and not worry about, bleeding through a pad and onto their clothes. I work hand in hand with dermatologists all the time with, young people with acne and wanting to control that a little bit better. I mean, there's so many other uses for birth control. And again, up to 50% of people on some sort of hormonal method are using it not for contraception.
Megan, Gillian, anything to add on that? Just some of the other uses for birth control and
Yeah, and I will say from a personal standpoint, exactly what Dr. Staci said. Like when I was a lot younger, like the birth control for me was for other health benefits other than, in addition to an unplanned pregnancy, but, acne, pain with your period. And so I think that's a really important point that 50% of people are using birth control in addition to or other than just for an unplanned pregnancy. And I think that's really important to know, which is why, again, it's so important that access be available for everyone to be able to get birth control.
Yeah, I agree. I mean, all the health benefits people can get from that, period control, pain control. Sometimes I wonder if we had labeled birth control something else and it was like a way to control acne. Side effect, you also won't get pregnant. If the branding would somehow make it be less controversial, but because it deals with birth control, which is sex, people get uptight about it. And, sex outside of heteronormativity is very, very, contentious right now. So I think if we, just say, this is for me, it's for my body, this is what I'm choosing, that should be the end all argument, because when people try to regulate other people's bodies, that's when we're going to have problems.
Megan, you heard it here first. We're going to call it something other than started a movement.
New brand.
And Megan, you mentioned earlier too, it can be gender affirming too, right? Like taking periods away for people who periods are traumatizing for. It can be very gender affirming. So that's another benefit that you had pointed out earlier.
Yeah, for sure. I mean, you can have gender dysmorphia because if you're feeling like, I'm not in the body I should be, and then suddenly I'm having a period too, that could just be another layer of, confusion for you. So if we can take away that variable that's causing you distress, amazing.
Cannot agree more. Well, as we all know, these questions and topics are so important. We could literally discuss them for days. But I'm going to wrap it up with this final question. Why are y'all thankful for birth control today? Anyone can chime in. Why are you thankful for birth control?
I'm happy to go. So, I think I'm thankful for birth control. And as some of you might know, and hopefully by the end of this, everyone will know that here at Power to Decide, we have Thanks Birth Control Day. And so we give thanks for the many opportunities that birth control continues to make possible for women, families, societies, since it became legal by the Supreme Court for women in 1972. And I think birth control really makes possible, opportunities, right? And while it might not be quantifiable, it really is evident that opportunities that birth control presents helps people to live their best lives. And I will just give a personal thanks for birth control because it allowed me to go to school, right? To pursue my bachelor's, a master's, my PhD. It helped me to make decisions on the number of children that I wanted for myself. It empowered me to make decisions that were right for me, to stay on a path to fulfill my dreams, right? And so birth control, again, was affirming, it was freeing. And I think that, I think all of us here want to give thanks for birth control, but also, again, to provide that same measure of freedom, access for others as well, to make sure that everyone has the opportunity to live their best lives.
Absolutely. To echo what Gillian said, not quantifiable. When you say, it's not quantifiable because you don't know the variables, because you put this in place, a lot of doors that might have opened remain closed because you said, hey, I'm taking care of this variable. I'm not going to get pregnant. I don't want to get pregnant right now. That's great. It's given you the latitude to do and pursue other things, which is so awesome. So for me, I don't want kids at all. So I'm on a non-hormonal IUD and I have sex. And I'm grateful all the time to have double birth control options with using an external condom and an IUD to not have a baby. And so that peace of mind isn't quantifiable, but I know it's there because that's one thing I don't have to worry about because of birth control. So I'm so grateful for that. And so someone who wants to follow along in my path or just wait to have, delay motherhood is so great. So having those options is so crucial and key, because we've seen that having a child earlier on in life, unplanned, it throws a big wrench in things. Not saying that people don't do it with great success, but that wasn't part of the plan. And so giving people control of what their bodies do is so important.
Yeah, I agree. Just like we've said, personally, it's allowed me to achieve what I've been able to achieve in education and going to medical school and being the first person in my family to go to medical school and be a physician, and to be the physician that I wanted to be, and then plan my family when I wanted to. So I was able to take control of that and plan when I wanted to have kids, when it was right for me. And so I was lucky enough and fortunate enough to be able to do that. And I see that for my patients too, that I'm just so thankful that there are so many different options. Like we talk about birth control, and I think so many people just automatically think, oh, the pill, right? Birth control pills. Well, yes, pills are great and they're easy and they're convenient, but there's so many other options. And birth control includes IUDs, it includes surgeries and sterilizations, it includes barrier methods, and it includes fertility awareness methods. I mean, all of these things are birth control and birth control options and choices that we have for, and for me particular, my patients, that I can give my patients that choice, those options, that freedom to do everything that they want to do, to live their lives freely, to have sex freely, to be able to go to school and to work without having to call out sick or to come home for the day. I'm thankful to be able to give that choice and that freedom to my patients every day.
Oh, so moving, so moving. I just wanted to say thank you so much to our panelists. I got so much out of this conversation, and I hope y'all did too. And for those of you listening, thank you so much. If you want to follow our amazing panelists and their work, you can get in touch with them on social media. For Dr. Megan Stubbs, you can find her on all platforms at Sexologist Megan, SEXOLOGISTMEGAN. For Dr. Staci Tanouye, you can find her on all platforms at dr.staci.t. So that's dr.staci.t. And to stay in touch with the work of Dr. Gillian Szal and the amazing team at Power to Decide, you can find them at Power to Decide on all platforms, Twitter, social, Instagram, and Facebook. And then finally, of course, this Wednesday marks Thanks Birth Control Day. Be sure to use the hashtag Thanks Birth Control. That's THX Birth Control. See you all on social media. Thank you so much.
Thank you.
Thank you.
Bye.